Welcome to Busting HIV Myths with 9 Circles Community Health Center. Today we will bust a few common myths about HIV and explore the reality of living with HIV in Manitoba in 2017. HIV affects everyone, so we hope you'll stay tuned. Hi there, my name is Shauna.
And I'm Srinath.
Srinath and I are health educators as part of the Manitoba HIV program, and we work out of 9 Circles Community Health Center. The Manitoba HIV program provides specialized care to the nearly 1,300 Manitobans living with HIV. The Manitoba HIV program operates out of 9 Circles Community Health Center, as well as Health Sciences Center Outpatient Clinic, and in Brandon at the 7th Street Health Access Center.
With expertise in the care and treatment of HIV, hepatitis C, and other sexually transmitted infections, 9 Circles Community Health Center delivers comprehensive primary care, social support, education, and prevention services for the benefit of all Manitobans. We are located on 705 Broadway and offer testing, treatment, and education. Our clinic is staffed with medical and social supports for the benefit of those who are living with HIV as well as affected by HIV and STIs. Before we bust for some of our first myths, let's take a look at and define HIV. HIV stands for Human Immunodeficiency Virus. H is for human, pretty straightforward. This goes to say that this virus only affects humans or people. I is for immunodeficiency, which means to say that this virus goes on to target our human immune system, thereby depleting it to such an extent that we become vulnerable to several opportunistic infections, including things like pneumonia, tuberculosis, certain types of cancers, etc. V is for virus, which means HIV is a virus which actually needs a host to live in. So if the host does not have it, what I mean is once the virus is outside of the host, the virus will not survive for long.
That brings us to our first myth. The myth that you can get HIV from kissing or sharing a water glass. No, not true. HIV transmission can only happen a few ways, most commonly through unprotected sex and sharing needles. Only 5 body fluids have the ability to transmit HIV. These are blood, semen, vaginal and anal fluids, which are naturally occurring lubrications, and breast milk. HIV can only be passed when one of these 5 fluids from an HIV-positive person enters the bloodstream of someone else. This is usually through broken skin, the opening of the penis, or the wet linings of the body in the rectum, vagina, or foreskin. The great news is that HIV cannot pass through healthy, unbroken skin. The 2 main ways that HIV is passed from person to person is through unprotected sex and sharing needles. Last year in Manitoba, 81% of the new cases were through unprotected sex. Only 11% of new transmissions in 2016 were through shared needles, which means that the main driver of HIV in Manitoba is sex. Manitoba has routine practices for locations that offer acupuncture, piercings, or tattoos to ensure against HIV transmission or hepatitis C transmission. We also have routine testing for HIV for pregnant people in Manitoba, meaning that they can access treatment if necessary and have healthy pregnancies. In fact, all of the 19 babies born to HIV-positive moms last year were born HIV-negative. HIV cannot be passed by talking, shaking hands, working, or eating with someone who has HIV. Cannot be passed through hugs or kisses, coughs or sneezes, swimming pools, toilet seats or water fountains, bed sheets, towels, forks, spoons, cups, or food, insects, or animals. Considering the fact that sex is the dominant mode of HIV transmission, there are tools that we can use to make sex safer. Regular HIV and STI testing is key for many reasons. A test is the only way to know conclusively if we have a sexually transmitted infection. Once we have a result, we can then quickly access treatment and prevent passing it on. Infections that are left untreated can make us more susceptible to other STIs, so it's good to take care of them as soon as we can. It's important to know that many STIs have a cure, and that those without a cure do have treatment. Speaking to our health provider can also help clarify our concerns around sexual health. Getting accurate information can help us make decisions that really fit into our lives. Then of course there are the safer sex supplies that you can get from 9 Circles or other locations around Manitoba, like condoms, lube, non-latex materials, dental dams, etc. that you can get for free in Manitoba. To reduce the harm from using drugs, there are similar steps and tools to stay safe. Regular STI testing again is key. It's good to take care of any infections that we may have and access treatment as soon as we can. Speaking with our healthcare provider can also help us clarify our health concerns around drug use. Getting accurate information can help us to make healthy choices that fit into our lives. Then there are the safer drug use supplies, like new needles, filters, spoons, sterile water, tourniquets, and sharps containers, which you can get for free at 9 Circles and at other locations around Manitoba. Using new equipment that is never shared and disposed of properly keeps everyone protected against HIV and hepatitis C.
Our next myth is that HIV is just a gay man's infection. No, this is not true. Anyone can get HIV. In Manitoba, most people who get HIV identify as heterosexual. Many societal factors, including poverty, access to education, geographical location, and racism, can put people at higher risk of HIV infection, but HIV does not discriminate. HIV by no means is confined to people who are gay only. Anyone can get HIV. All of us are at risk of getting HIV from unprotected sex or sharing needles. Close to 6,000 people get infected with HIV every single day across the world, and they belong to all walks of life. Here in Manitoba, majority of those infections that happened in the year 2016 were heterosexually transmitted, and about 25% among men who have sex with men. It is important that anyone who is sexually active, no matter their age, gender, or race, build routine testing into their healthcare. Everybody has an HIV status. It's either HIV positive or HIV negative. The fact is that only 8% of Winnipeggers got to know their status in the year 2016, and less of us in rural Manitoba, which means that most of us do not know our status. This is precisely why the Manitoba HIV program recommends that if you are between the ages of 18 to 70 and sexually active, that you test every once in 5 years. You may want to test more frequently if you use injection drugs or are concerned about STIs, or you change sexual partners. You will also be tested if you become pregnant. Your best bet will be to have a conversation with your healthcare provider and come up with a plan for routine testing. 9 Circles Community Health Center offers free and confidential testing. Anyone can drop in on Wednesday between 12 noon to 7 p.m. You do not require an appointment. Drop-in service is on a first-come, first-served basis, or you can make an appointment from Monday to Friday between the hours of 9 a.m. to 5 p.m. There are many places here in Manitoba which offers HIV testing. You can also ask your doctor for routine HIV testing.
Another myth that we want to clarify today is the belief that contracting HIV is a death sentence. No, that is not the case. Thanks to medical advances and better treatment options, an HIV-positive person can have a near normal life expectancy. Most people living with HIV do not die with HIV. Let's bust this myth by looking at how HIV works inside the body. As Srinath said, HIV targets the CD4 cells of our immune system. When our CD4 cell count is high, our body can fight off infections. But when our CD4 count is lowered by HIV, it means that it will do damage to our immune system. Someone living with HIV may not recognize any symptoms, or may live with their symptoms for many years without knowing it. But if HIV is left untested and untreated, it will seriously damage our immune system. This is why we at 9 Circles encourage people to build in routine testing for many STIs that commonly have no symptoms. The sooner we can find it, the sooner we can start to treat it. The medications for people living with HIV are called highly active antiretroviral therapy, or HAART for short. The goal of HIV treatment is to reduce the production of HIV in the body, which allows the immune system to strengthen again. Taking HIV medication daily and engaging in healthcare can help people with HIV improve their immune system and live a normal life expectancy. With successful HIV treatment, the amount of virus can become very low or undetectable in the blood or other bodily fluids. This means that transmitting HIV becomes much lower. New data from important studies continue to show that HIV medications are a big tool in preventing the transmission of HIV. But while HIV medications can reduce the amount of virus in the body, it can't eliminate it completely. Researchers are still working on a cure. The HIV medications have come a long way and have been a game changer for HIV. You can see from the blue graph that before 1996, HIV-related deaths were on the steady rise in Canada, but that in 1996, when antiretroviral therapy was introduced, there was a dramatic drop, and that ever since, HIV-related deaths has been declining in Canada. Then looking at the purple graph, along with fewer deaths, is the growth in life expectancy for people living with HIV. Manitobans can access HIV testing, care, specialized treatment, medications, and social supports, which means that HIV is a game changer, but that with medical supports, it is in no way a life sentence. The reality of HIV has changed a lot since the 80s and 90s. Today, there are HIV-positive people across Manitoba living active lives, having children, raising families, going to school, attending work, and managing their health just like everyone else.
Let's take a look at our next myth. If you have HIV, you have AIDS. This is not at all true. HIV is a virus. AIDS is a diagnosis that is given to someone with advanced HIV when they meet certain criteria. And language matters. Saying someone has AIDS when they actually have HIV creates stigma and sends out a wrong message. Many people believe HIV and AIDS are the same. HIV and AIDS can be confusing, but they are not the same. They are different. HIV is a virus that can lead to a condition called AIDS if left untreated. Many people who are living with HIV today can avoid getting into the stage of AIDS by accessing treatment or medications. With early testing and treatment, people living with HIV can have a perfectly normal, active life. Unfortunately, stigma is the biggest barrier against HIV. Stigma is a mark of disgrace, a mark of shame, or discrimination attributed to a person. Stigma associated with HIV leads to isolation, which has a significant impact on their quality of life. Stigma and discrimination can also have a significant impact on the way people access services. People may refuse to access services such as testing, treatment, and other support services. Here's a wonderful video that best describes the impact of stigma and the way forward.
Do I look at you or do I look back?
If there's any question that you don't want to answer,
Yeah, I'll just throw this chair at you, don't worry about it.
So my name's Josh.
My name's Michael.
Rodney Russo.
My name's Mike Schneider.
I'm Ashley.
My name is Tim McCaskill.
I'm a PhD student in immunology at U of T.
I like to swim, jog, go to the gym a couple times a week.
I'm just in the process of retiring.
I was diagnosed 9 months ago.
So I was diagnosed in 2011.
2 weeks before my 18th birthday, to be exact.
When they developed a test, 86.
It's been over a decade that I've been HIV positive.
So was there a specific reason you went to get tested?
I joined the U of T epidemiological study in 1983, and I said, by the way, I hear that there's a new test for this new virus that they've discovered. Have you tested me for it? And the doctor said, well, do you really want to know? And I said, well, yeah, if you've tested me for it, I think I want to know. And he said, oh, well, okay, you're positive. If I hadn't asked, he would have never told me, no.
Wow.
I left high school. I'm 6'2", I was 240 pounds, almost had a 40-inch waist. Within a 3-month period, I was down to 120 pounds and a 29-inch waist. So, kind of threw me in for something's not quite right here.
Do you remember what it was like when you found out you were HIV positive?
I remember being completely numb, feeling like I was caught in a dream.
Uh,
It was pretty terrible.
as you might expect.
I kind of burst into tears, and I was sad for the first little while.
And it's such a cliche, but it's like you never think that it's going to be like it's going to be you. I worked for a non-for-profit agency that told me that I was a burden to the agency because I was upping their premiums for their prescription drug coverage. So I did receive coverage, but then in turn was being viewed now as liability for accessing that coverage.
My mom goes, no matter what happens, you will always be there. We'll always be there for you. It doesn't matter.
What do you wish people knew about being HIV positive?
Don't assume anything about what it's like to be positive. Everyone is scared as shit to become positive. So it's kind of paradoxical that people can say things like, oh, it's not that bad, because, I mean, it's true that it's not, but at the same time, it still just really is shitty. Not the health, biomedical parts of it, mostly just like the stigma and living with people's perceptions of what it means to be HIV positive.
You know what? It's today that it's a manageable illness. It's not a disease. It's not the death sentence that it used to be.
I think a lot of people still kind of are still in that mentality, of that death sentence mentality.
Well, I think a lot of people, still view it as a death sentence, but by no means does HIV stop you from fulfilling your biggest dreams, reaching your fullest potential. If anything, it's the stigma that still exists today that holds people back.
I wish more people were aware of the difference between HIV and then AIDS, especially. But definitely stigma, because stigma is what hurts everybody living with HIV the most. Even if they're confident and doing well, they're impacted by stigma on some level. And the stigma usually comes from rejection, denial of jobs, people having misconceptions about how they can get transmission or, how it could be passed along.
I've had a few friends or family members, they find out that I have HIV. I wish they would, instead of stepping back or turning their back, they would ask questions if they're not educated.
I went in and spoke to a group of young people who've been recently seroconverted, and I said that I had been positive probably. I was probably infected in 79 and 1980. You could see kind of the blood draining from their face. The real problem is that people get tested, they seroconvert and think, oh, my life's over, so they drop out of school or stop working. And so to see somebody who had been living with HIV longer than they had been living, period, I think they suddenly realize, oh shit, right, maybe I have to deal with the rest of my life now.
What do you wish people knew about getting tested?
I wish that they knew that it's not a scary thing to do, because it's only 3 or 4 minutes.
Just go in, get tested, and once you know your status, you're a lot better off for it. I know people who felt relief when they found out. I know people who were devastated. I know people who cried. I know people who felt like it was a foregone conclusion. I mean, the responses to a diagnosis are really complex.
I mean, there's reason to be concerned about finding out you're positive. Like, as soon as you know you're positive, you now have a duty to disclose, which for some of us is easier, and for some people it's more difficult for a number of reasons. Even consider Charlie Sheen coming out as HIV positive. In him finding out that he became positive, he underwent a number of social factors like blackmail, simply because he was positive. So we need to consider the social impacts of finding out that we're positive.
The population today, the I don't know, I don't care category, is statistically the ones that are passing it at the alarming rate. Those who have gotten tested are on, treatment, being monitored by a doctor. When they get to their undetectable viral load, it's like a 4% chance they have of passing it.
What advice would you give to someone who may be thinking about getting tested but doesn't know if they should?
If you're nervous, take a friend with you, right? That helps, having someone to be there with you, while you're going through in the waiting room.
You can be completely anonymous when you get tested. You can go to your doctor, get tested. To have a buddy there doing the test with you, good for you, good for them, good for the public. Everybody knows at the end of the day. And then that way, if you do get a result that you weren't expecting, you've already got that person there with you.
Thanks so much for watching today. We hope that we've clarified a few old HIV myths and expanded on the realities of living with HIV in Manitoba. If you are one of the many Manitobans who does not know their HIV status, we encourage you to get tested. You can come to 9 Circles at 705 Broadway for free testing, or ask your health practitioner to build in routine testing that works for you. It's free, easy, confidential, and the only way to know your HIV status. If you want more information about what we do at 9 Circles, you can visit our website at www.9circles.ca, or find us on Facebook and Twitter. Thanks so much for listening today. See you later.
Does your community group or organization have an educational session, lecture, or workshop that you would like to have on Winnipeg Talks? Send us an email at createtv@sean.ca. Give us a call at 204-480-3500 or find us online at Sean TV, Winnipeg.